All right, welcome to part 2 of lab review for 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 lab 1. Okay, so in this video we're going to be going over the bones that you're going to need to know for the lab exam. Okay, so on any vertebrae, pretty much, you are going to have the body, which is going to be this big portion right here. If you're looking at it sideways, it's this part right here. So that's the body. The second one is the vertebral arch, and some people get that confused with the vertebral foramen. The vertebral foramen is this big hole right here, but the vertebral arch is the part of the bone that makes the hole, the archway, okay? Now, the lamina and the pedicle. Leonard, tell us where the lamina and the pedicle are.
Well, the lamina and the pedicle would be found in the specific areas. So let's see here. You have the pedicle, which comes right after the body. So this area right here and this area right here. So after the body is the pedicle. Your lamina would be found in this area right here. And they come right before this process here, and this process here is called the spinous process. So your pedicle is found right after the body, and right before the spinous process is your lamina.
Excellent, Leonard. Excellent. Okay, so the next one we're going to show you is called the transverse process, and that really can only be found on any of the cervical vertebrae. The transverse process...
Foramen.
What?
The transverse foramen is only...
Transverse foramen.
Transverse processes are better.
Yeah, sorry. Yeah, transverse foramen.
Transverse foramen.
Transverse foramen. Don't listen to me. Okay, so the transverse foramen can only be found on the cervical vertebrae, and the transverse foramen are these little holes right here. This is the vertebral foramen, transverse foramen. Only found on the cervical vertebrae. Remember that. The next one is the inferior and superior vertebral arches, or notches, excuse me. And those can really only be seen when the vertebrae are together as they should be. If I can get these things to stay together. Okay. All right, so I can get close enough. This area, this area right here is going to be your inferior vertebral notch. The area on top is going to be your superior vertebral notch. Inferior, superior. And your, I think we already covered that, the intervertebral foramen hole right here.
No, that's the vertebral foramen. Intervertebral.
Oh, intervertebral foramen. I can't read. Okay, the intervertebral foramen can also be found when the vertebrae are together. And the intervertebral foramen is this hole that is in between the foramen. It's right here. So on the lab exam, they might have a Q-tips sticking through the intervertebral foramen like this, and they'll probably ask you, like, what is this hole in between the vertebrae? So. Okay, so tell us about the cervical vertebrae, Leonard.
Okay, so your cervical vertebra are the 7 bones right on the top, and they're much smaller than all the other vertebrae. So the first 2 vertebrae is called your atlas and your axis. Now, your atlas, that is where your skull sits on. And then what makes it different from any other, it doesn't have a body. It has these transverse foramen, but it doesn't have a body. So this is your atlas. Take a good look at it. Okay? Now right under it, it fits right like this, is your axis. And what your axis does is that it helps with turning your head. So what makes this different, it has this big little bump right here, and this is called your dens process, or your odontoid process.
Just remember dens, it's simpler.
Yes. So those are your first 2 cervical vertebra. Then what makes cervical vertebra different from any other vertebra is that it has this thing called bifurcated spinous processes. And what that means is that it has two specific processes that kind of stick out. And that's different from your thoracic vertebra, which is right under your cervical.
And your lumbar.
And your lumbar. So.
And your sacral. And your coccygeal.
Yes. So, your thoracic vertebra is the 12 bones right in the middle. So, your thoracic vertebra are these things right here. And what makes it different, it has this really long, skinny spinous process. And how people can identify is that it looks like an animal. In this, it looks more like a giraffe. I would say a giraffe. So,
or elephant.
Or an elephant.
Whatever works for you.
Yes.
Whatever helps you remember.
Like that. Frontwards like this. Yeah. See, look.
You see, like the ears, and you got the little horns there. It's like a giraffe.
It's like a giraffe or an elephant.
You can name it Melman.
Yeah. So yeah.
If you ever see Madagascar.
Yes. So these are your thoracic vertebra.
So professional.
I know. Next is your lumbar vertebra, and these are the really thick, large vertebra at the bottom. And what makes this different is that the spinous process is not really short. It's so cute, and it's thick. And there is 5 of them. So how you can remember the difference between the cervical, thoracic, and lumbar is breakfast, lunch, and then dinner. So 7 o'clock, 12 o'clock, and then
5 o'clock.
5 o'clock. So that's how you know how many in each vertebra. Okay.
Oh, apparently lumbar vertebrae looks like a moose.
No, it does. I promise. No, not that one. This one. That looks just like a moose.
It looks like a moose.
Oh yeah, kind of.
Oh, look, this angle actually looks the best.
Oh yeah, I actually see that. That's really cool.
It's a moose.
Thank you. Thank you. Yes.
Or sound effects.
Yeah. I can make noises that'll help you remember. Okay.
Okay. So tell me, Morgan. Tell me about this bone right here.
Okay, this is your sacral and your coccygeal lumbar. Vertebrae, all forged into one. Okay. So on your sacrum, which is going to be this part of the bone right here, you have your ala or your ale, however you want to pronounce it, and those are going to be this part of the bone right here. And then you have your sacral foramina, which are these holes right here in the vertebrae. And then you have the sacral promontory, which is going to be this thing right here. This is where the rest of your vertebral column attaches, right there. So this is going to be your sacral promontory, and it's actually more of the edges than the actual body part right here. So this edge right here is going to be your sacral promontory. And then these 3 to 5 little vertebrae down here is called your coccyx. I think that is one of the greatest words ever. I think it's so much fun to say, coccyx. This is affectionately referred to as your tailbone. So when you fall really hard and your butt hurts for a couple days, you've probably bruised your coccyx. So that's your tailbone.
Yes.
The next part is going to be the sternum. And the first part on your sternum is going to be your manubrium, which is going to be this part right here. And the parts of your manubrium, you have your clavicular and your jugular notches. Your clavicular notches are going to be these two guys right here. This is where your clavicle bones attach, and you can actually feel it right around here. And then this guy up here is your jugular notch. Okay? And your sternal angle, I don't know how well you can see it. I'll get as close as I can. But it's this line. It's this line right here. That's your sternal angle. Okay? And the body is going to be this part right here. This is the part that you would press on if you were performing CPR on somebody.
Sounds like burgers.
Yeah. Now, the, I can never pronounce this right, the xiphoesternal joint.
Yes. Good
Okay.
job.
All right. That's also going to be this little line right here. That's your xiphoesternal joint. And your xiphoid process is going to be this thing right here, this little pointy thing right here. And also, when you're doing CPR, you have to be sure not to do your compressions too hard, or else you could break this, and that could kill your patient, which isn't good.
Yes.
Okay, so Leonard, tell us about the ribs.
Okay, so this is the ribs. So we have here the specific parts. I'll tell you about the specific parts. So right here, this part right here, this is the head. And this is connected to this is the part that connects to your vertebra. So, this is the head, which is a little thicker area. When it becomes slightly thinner, if you think of it, oh, there you go. It becomes thinner right here. This is called the neck. And right after that is this big bump right there. That is called your costal tubercle right there. And after that, this big long area right here, this is called your body. Or the
shaft.
Or shaft. It's called the body or the shaft. Now, at the bottom side of the rib is called the costal groove, which is this little indentation area right here. And this is where your blood vessel would flow under. Next is your costal cartilage, which are these little things right here. And these are what your ribs connect to. So it's like like this. It's like this. Yes. And how you can tell the difference between a left and a right rib is that when you look at this, like right here, the head should connect to the back side, and the costal groove needs to be at the bottom side.
Mm-hmm.
So when you connect it to your body visually in your head,
Because you can't touch any of the models on a lab exam.
yes. So when you put it on your body visually, it goes like this.
The head, the head attaches to your vertebral column.
So this would be the left rib, while this right here would be the right rib. So yes, see, look. Okay.
12 of those on each side.
Yes. So next, we're talking about true ribs and false ribs. So these ones up here, these are called your true ribs, or vertebrosternal. Vertebrosternal.
Think about it as like they attach to your sternum. So
Yes.
vertebrosternal.
Vertebrosternal. So the vertebra connects to the sternum. So these are directly connect to the sternum. So these right here. These other ones, these are called the false ribs, or the vertebrochondral. And what's because it actually fuses and then it connects to the sternum right here. So it's not directly connected to it. And also there's the floating ribs.
Where's that skeleton?
Skeleton.
This is Bob.
Yes, Bob here is gonna tell you, or he's gonna show you actually, the floating rib. So, can you see it?
Yeah, we
these
can
ones
see
are
it.
here. This one right here. So this is a floating rib. It doesn't connect at all to the sternum. They're just in the back area right there. All right.
So that is all the bones that you have to know for A&P Lab 1 exam.
Bye!